So, hello everyone. Welcome to what is the 11th webinar in the Human Behaviour Change Project webinar series, Exploring Trust in Artificial Intelligence. And just to let you know, this meeting is being recorded and will be made available via our YouTube channel afterwards if there's anything you miss or if you'd like to share it later with a colleague. So, what format are we going to take today? We have three presenters, myself, Ava, and Ella, and we're all going to talk about the work we've done as part of the project, Exploring Trust in AI. And what we'll do is we have roughly a 25-minute presentation and then a 25-minute discussion. And for the discussion, if you type your questions into the chat box, and also in the chat box, it's possible to upvote a question. So if somebody asks a question that you'd like answered to, then please do upvote it, and we will try to answer questions that are the most upvoted first. If we do run out of time for any reason, we will make a note of all the questions that went unanswered, and we will actually write answers to those and put them up on our Open Science Framework link afterwards. So please don't worry. If you've asked our question, we will do our very best to make sure we answer it either during the session or if necessary afterwards. Indeed. So this just covers what I just mentioned. Also, if you have any thoughts or any reflections, please do also use the chat box to share those. And we will indeed keep a record, not just the questions we don't get around to answering, but also the ones that you did ask, and make sure that they are all there for posterity on Open Science Framework. So we are recording every webinar in this series, and this is because we appreciate we have colleagues around the world who are interested in this work, and not everybody is free at a given hour on a given day. We have a YouTube channel where we're uploading the recordings. The slides themselves will be made available on Open Science Framework. We have Human Behaviour Change Project site there. And we will also link you, our webinar participants, the links to both the recording and the webinar slides, so you don't have to go searching around trying to find them. You can just follow them directly. So moving on, let's have a look at what we found about trust in artificial intelligence and presenting the results from a public engagement project. Now, the reason this came about was inspired by the project itself. And the Human Behaviour Change Project was given impetus by the difficulties of evidence-informed public health policy making because of two big problems. There's a fast-growing and diverse evidence base that's quite hard to track down and get the information out of. And then the time actually required to synthesize this evidence. And as a result, the Human Behaviour Change Project uses artificial intelligence and machine learning for three things: finding relevant evidence, extracting information from evidence, and predicting the outcomes of behaviour change interventions. So our first use case was smoking, and the sort of prediction the system might be able to deal with is how effective is one-to-one telephone support from a nurse likely to be for people who want to quit smoking. If you're interested in the details of any of those three AI systems, they were covered in previous webinars, which you can go back and watch via our YouTube program. None of the people on the call today are computer scientists, but we do have webinars that were presented by computer scientists. So if you're interested in technical detail, I'd very much point you to those other webinars. Okay, so why do we care about trust in artificial intelligence? Well, we know that trust affects adoption of and engagement with many novel technologies. And throughout the project, people have said to us, well, isn't trust going to be an issue? How trustworthy is your machine learning system going to be? How much should users even trust its outputs? Should citizens be concerned, and what concerns might they have about public health decision makers using the HPCP system or a similar AI-based system to make decisions about what types of public health service to provide or other aspects of public health? And these concerns are relevant not just to public health, but also things like healthcare and other public service decision making. So we thought it was worth doing some work around them. So in terms of what we're going to talk about in today's webinar, we're going to start with defining trust in AI and identifying the factors that influence user trust in AI when it's applied to healthcare. We'll then introduce the public engagement project that explored trust in AI applied to public health decision making, and share the toolkit that was created as a result of it, and then have time for audience questions. So we look forward to sharing our work with you today.
So let's start with the first core question. What is trust in artificial intelligence? Now, there are many different ways to talk about it, so I suggest we take it to the beginning. And this is pretty much where we talk about trust in the human context. Because when we commonly talk about trust, it's really in the context of humans. So trust in humans. And in that area, we might define it as the willingness of a person to be vulnerable to the actions of another person based on our assessment about the characteristics of that other person. So what does that mean? Let's break it down. To make ourselves vulnerable to someone means we're giving up control. We rely on the other person to do or not do something, but we don't really have control whether they actually will. So there is some uncertainty, we're taking a risk. And that's really important because if there were no risk or uncertainty, there would not be a need for trust. Now, the second part is the assessment about the characteristics of a trustee. Or in other words, we're judging the other person's trustworthiness consciously or subconsciously. Now, what might these characteristics be that determine someone's trustworthiness? There's different ones, and I'm just going to go into 3 core ones. So the first one is ability, and that's our belief that the trustee has the ability to do what we need him to do. The second one is integrity. So we believe that that other person adheres to a set of principles that we as a truster find acceptable. And the third one is benevolence. So our belief that the trustee will want to do good aside from an egocentric motive. Now, what this points to a little bit already is also that trust is context specific. So let's take ability, for example. We don't all have every possible skill that there is. To make it a little more tangible, so let's take my little brother, for example. I trust him to carry me up a flight of stairs. I trust him to keep a secret, but I would not trust him with cutting my hair. I'm sure he'd want it to look nice because he'd have to be seen with me, and I'm sure he'd make it safe, but he simply does not have the ability to cut my hair. Now, this is trust in humans in a very short version, but how does this translate to trust in artificial intelligence? Now, when we look at trust in artificial intelligence, we can see some similarities. So it's our attitude towards the application, about the application's ability to perform an action that's important to us. And our attitude, similar as in humans, is comprised of a set of beliefs about the AI's capabilities and characteristics. Or in other words, again, capabilities and characteristics translating to the trustworthiness of an AI application. And this is also based on different beliefs, and we can roughly categorize them in the following ones. So the first one is functionality. So that's our belief that the specific application has the functions or features that we need to do what we want to be accomplished. The second one is reliability. So the belief that the specific technology will operate consistently and properly. And the last one is helpfulness. The belief that the specific technology provides adequate and responsive help for users. And again, this is context specific. We trust a system to carry out a specific task or a small set of tasks, but not universally. Now, the trustworthiness here really reflects characteristics or attributes of an AI rather than its will or motives, because it doesn't really have that due to lacking volition and moral agency. So we know that there are some kind of beliefs that make up our trust in artificial intelligence. And the next thing I would like to do is to kind of look at what influences our trust in artificial intelligence. And we have this wonderful logic model here. I'm not going to go into every possible detail so you can learn more about our public engagement project, but I briefly want to touch on some key points. So when we look at this logic model, we can see that there are many different aspects. And I want to point 3 out. So the first one is really the human or the user. The second part is the AI application itself. And the third one is basically the rest here. So the context, which includes, for example, the company that stands behind an AI application, the media as one factor, and the social network, both professionally and personal. So when we look at the attributes of a user, we can see, for example, that what we know about AI or technology in general, what we expect of a technology, can influence our trust. When we look on the side of the AI application, there is different aspects such as transparency, how well the system performs, and all of these attributes as well can influence how much we trust an application by influencing how trustworthy we perceive it to be. And that in extension can influence our behavior. Now, why does trust matter? AI systems, whether it's the HPCP knowledge system or something else, are never perfect. There might be issues with accuracy, quality of data, and other things that influence the trustworthiness of an AI system. And what does that mean? It means that there's risk, that there's uncertainty, and that we really need trust to bridge that gap, to take that leap of faith. And similarly, there are obviously systems that don't perform so well. And all of this is exacerbated by this information asymmetry between developers and users. Now, a prime condition for trust is the lack of full information. Now, as someone on the side, for example, of the HPCP, I might know a little bit more about what goes into the system, what happens, and I might find it a little easier to assess how trustworthy I find it to be compared to someone who hasn't been part of this process at all. So if we had complete balance in information between everyone involved in using the system, then trust might not be that relevant. But the ultimate thing and why a lot of people are researching trust is this idea that trust influences our engagement, adoption, and use of a technology. So that's actually quite intuitive. So if we think about if we don't really trust something, would we use it? Well, probably not, right? And that's where it gets really interesting, because we could have the best system, but people won't use it or properly adopt it if they don't trust it. And that's why trust has gained a lot of interest, because we realize that if we want to realize the assumed potential of AI as a broad category, but also specific applications, we need to build trust in it, and we need to get the buy-in from people. Now, that is very broadly speaking when we think about trust in AI on a broader scale. Why are we specifically at the HPCP interested in it? Now, as you can imagine, we're a group of researchers who has been working on this project for several years. And as I just said, we know no system is ever perfect. We know there's an asymmetry, and we want our system, of course, to be used. And we want it to be trusted. But the question arose, well, do our users actually know, or can they judge the trustworthiness of the system and its predictions? And that's really important, because we don't want people to trust blindly or categorically distrust AI applications. Both of these are bad. What we ideally want really is that people are in a position to make an informed decision about when and how much to trust the system. Now, I'm going to acknowledge now that this is, a high set goal or standard, and we might never fully achieve it. But the question really is, how can we get closer and work towards that goal of getting people and helping people into that position? And that's what brings me to those two questions. Now, we asked whether they can judge the trustworthiness. And we thought, well, we need to take it a little bit back. First, we need to kind of figure out maybe how do users feel about the use of AI for population health. And that includes both actual users of systems, but also those people affected by it. So for example, if we think about the HPCP system, if it's used by someone to inform a decision of what intervention, for example, is going to be funded to help people quit smoking, then the person on the other hand that is going to be influenced or not influenced by that intervention might also have an opinion about whether AI should be used or not in that kind of decision. And the second part really is about addressing that information asymmetry, empowering people. And how can we do that? How can we support people in critically questioning AI systems like the HPCP system and decide whether to trust it and whether they want other people, like decision makers, to trust it? And those 4 questions are really what led to our public engagement project. And this is where I'm going to hand over to Ella and Alison, who are now going to talk about the project and its results.
Thanks, Ava. So now I'm going to talk about the public engagement project and the process we took, and Alison is going to outline the outputs from this project. So the aim of our public engagement project was to explore, well, what do people think about the use of AI for population health, and what do they want to know before deciding to trust it? And we also wanted to develop a toolkit to support people in critically evaluating the use of AI. Our public engagement project took the form of 6 online public engagement workshops that happened in the autumn of 2021 over 6 weeks. And it involved 24 members of the public health professionals, research scientists, and a graphic designer. And this group of people came together from a number of different sources. It included users of smoking cessation services offered by Everyone Health, which is a company that provides community health and wellbeing services. It was advertised through UCL Co-Production Collective to a list of individuals who had expressed an interest in being involved in health-related public engagement projects. We invited people who delivered behaviour change services who could be affected by the use of AI to make decisions around public health. And also a group of 5 researchers from the Human Behaviour Change Project team, including myself, Ava, Alison, who's talking next, and also Dr. Alison O'Mara-Eves and Clement Veal. And we've all got backgrounds in behavioural science, health psychology, evidence synthesis. And we also had a graphic designer who joined us for the 6 workshops, who was there to be part of the project, listen to all the ideas that were coming up, the questions being asked, and to capture all this in the set of toolkit and the designs used for the toolkit. So before I go on to talking about the process we took, I thought I'd just explain what our understanding of public engagement is. And this is something that evolved over the workshops and was informed from a number of different definitions. But our understanding is that public engagement is when participants have a good understanding of the topic being discussed. And so that might mean that you have to give a bit more information in the first few weeks or workshops to make sure everyone's on the same page and knows what we're all talking about. That there are channels for feedback to avoid information provision being just one way, but there's a way for participants to provide their views and feedback. There's a common understanding of the goal that's trying to be achieved, and that everyone has an equal opportunity to contribute, and we treat all fellow participants with respect. So this is what guided the workshops that we carried out. So our initial plan for the 6 workshops was quite vague, because we didn't want to have planned everything so completely in detail that meant there was no flexibility and no opportunity for participants to shape the content of the workshops and the topics that were discussed. So this is our rough overview that we sketched out ahead of the first workshop, and we showed participants in that first week. And our plan was to spend the first 3 weeks getting to know each other in the project, exploring the good and bad points of computer systems, and perhaps in the 3rd week introduce graphic design and decide, well, what do we want a toolkit to look like and say, and then spend the final 3 weeks in discussing and refining concepts for the toolkit, and incorporating iterations of views on the toolkit before finalizing the design in the last week. But this, of course, really, when we were open for change, and it did change as a result of each workshop, because after every workshop, we'd give a feedback form to participants to ask them, well, what did you enjoy? What didn't you enjoy? What could we have done differently? And we also reflected on how we felt the workshop went. And those reflections and the feedback then influenced the slides for the 2nd workshop. And again, after the 2nd workshop, we'd do a feedback form, and then that would all inform the 3rd workshop. So it was actually quite a busy 6 weeks, because we'd have a few days to after finishing the workshop to then decide how was the next workshop going to be. So while it was very busy but rewarding process. And what we really wanted to show is that we were listening to participants' feedback. And so at the start of every session or every workshop, we'd talk about what feedback had been given and how we had or had not incorporated that feedback. So for example, we'd say, well, what you said was that you were unsure. This is some of the feedback from the first week. So you were unsure about the project and the purpose of these workshops. And so as a result, what we did to address that was ahead of every workshop, or rather after a workshop, is to give out a form to fill in questions. So if there were any questions, we could incorporate answers to those questions into the content for the subsequent week. So we try to do that at the start of every week to really show that we're listening to the feedback being given. And so what actually ended up happening as a result of this process was we spent the first 3 weeks really a bit more looking at what is AI, what is trust, what influences what people want to know about whether they'll trust an AI system. And then we got onto graphic design in the 4th week, and that's where our graphic designer, Jenny Ives, amazing graphic designer, kind of led the session. And then we spent the final 2 weeks with Jenny refining the design she put together and incorporating the feedback that we'd all give her. And so the content of the sessions was very much a mixture of us talking about concepts. So this is particularly for the first 3 sessions. I was talking about concepts like AI, the project, how do public health decision makers normally make their decisions, as well as incorporating lots of elements of interactivity. So we'd use Jamboards, which we found to be really, really helpful. We did some word clouds, polls, and there was also a lot of opportunity for participants to offer their views verbally. So we tried to make it a mix of both, because these were sessions that happened every Wednesday evening from 6 till 9. And so there would always be a break in the middle, and we didn't want it to be too content heavy and just us talking. So there was a mix of both. And then the kind of sessions 4 to 6 were very much led by Jenny, who kind of introduced us to graphic design and the art of storytelling, and really helped kind of make us think about, well, what do we want this toolkit to make people think, make people feel, and kind of what kind of language we want to tell our story. And Jenny would kind of, after each of the sessions, put together a mock set of toolkit designs, incorporating all the content from the workshops from the weeks before, and we'd give our views on whether we liked it, whether we understood what was being said, trusted what was being said, and that all kind of came together to then form the final toolkit. And I am going to now hand over to Alison, who's going to present the results from this process.
Thanks, Ella. So, in terms of the findings of the public engagement project, we came up with 2 key things from the group. And the first was the suggested context in which to use the toolkit, and the second was the different elements of the toolkit. So what do we mean by context? So what the group suggested was that for public health decisions that could be made using an AI system, policymakers should consult a panel of people representative of those who are going to be affected by that decision, with the aim that panel members can share their views and recommendations about whether the AI system's output should be used in that decision-making process. And they suggested that the panel members could follow a 5-step process to decide on their views, and the aim was that the toolkit was going to support people in going through that 5-step process. So the toolkit had 4 key things in its resources. First was an overview of the process, which I'll show you in a moment, a set of questions people might want to ask about an AI system, a guide to what things might actually be a good answer in response to a question about an AI system, and a tool to let people reflect on their kind of personal views and values in response to what they'd heard in those answers. So what did that look like? So this was what we called the roadmap, the Wondering How to Choose document, which was an introduction to the 5-step process that was aiming to help people think about the pros and cons of the AI system. And why do we call it a 5-step process when we've only got 4 sets of resources? Because our steps were actually, number 1, to find out what the decision was and who was going to be affected by it. So we discovered that not everyone actually appreciated how public health decisions were made, the idea that actually somebody somewhere determined what sort of smoking cessation help you might get, or what diet or weight loss support you might get in a particular area, was actually something people weren't always familiar with. We had a second optional step, which we pointed people at an existing very brief video about what is AI, for those who wanted to know a bit more about the technology. We then asked people to think about what they might like to know about the AI system using the question bank, and to consider their overall opinion of the AI system. And then finally to share their opinion. So what do those resources look like? This is one version of the question bank, or not sure what to ask as we called it. And what you can see here is questions based on the things we discussed in the group about different issues that people raised about things that might affect their trust in AI. such as how fair and unbiased is the system, what was the provenance of the system, training data, the availability of human support, how well the system actually works, its explainability, whether there are any existing recommendations to use the system. And so for each of these kind of big blobs, we then had specific small questions coming off it that people might want to ask about it. We then had a guide that was about actually, well, what might you be looking for in a good answer to those questions? That people had the feeling that, well, people could tell you anything. How would I know if they're sort of, selling me a line? What actually is a good answer to some of those questions on the mind map? And so we provided a guide, for example, in what you might be looking for in an answer to a question about training data. So for example, does it reflect diverse groups of people, including the people affected by the decision? About how well does an AI system work, where we included the fact that nothing was ever going to be 100% perfect, and that accuracy was only one way of assessing the quality of a system. And then we move on to the Your Personal Views tool. So this was to help people reflect on what they heard, the answers they got to those questions, and what they thought themselves about how happy they were with what they found out. So we had 8 statements which mapped onto the 8 areas in the mind map. So for example, I'm satisfied with what I found out about who developed the AI system and why they wanted to make it. I feel there's enough explanation about how the AI system works. I'm satisfied with what I found out about how well the AI system works and how it was tested. So 8 areas there. And for each one, people could rate strongly agree, strongly disagree, or something in between. And the idea was that completing this grid would give people a chance to reflect on and weigh up what they'd heard about all these different areas that might affect how happy they were to trust the AI system. So in creating this toolkit, we hope that we've supported citizens' ability to critically question the use of AI systems in public health decision making. And we think a strength of it has been produced through an online public engagement process, obviously by necessity, thanks to the pandemic, but nevertheless, a great advantage to this was it let us have diverse individuals contributing in a way that doing it face-to-face wouldn't have done. We used formative evaluation throughout the process, and we also did some summative evaluation, which I'm happy to talk about if anyone's interested. The toolkit and the associated kind of roadmap process give policymakers at either national or local level a way of providing accountability to citizens who might be affected by public health decisions if they were made using artificial intelligence inputs. And the toolkit is designed to be generic. It's not specific to the system developed as part of the Human Behaviour-Change project. Instead, we wanted to design something that would work across a variety of AI systems. And we think it could actually apply more broadly than population health, that it could work for other healthcare and other public service decisions. And the toolkit can be accessed by our website, which is artificialintelligenceinpublichealth.org. In terms of our findings around trust in AI, key factors that affected judgments were things like the decision and context to which the system was being applied. So, what were the stakes here? The system's background, who developed it and what were their motives for developing it? Training data, accuracy of the system's outputs, fairness of the system, explainability. So could you tell how the system came up with its outputs? Was there human support available from the system's developer if it appeared to be doing weird things or functioning strangely? And were there any pre-existing recommendations from experts that said this system is trustworthy or this system is appropriate to use? And what was interesting here is that these echo several of the areas highlighted in Eva's systematic review of influences on user trust in healthcare AI. So we can see that actually it's a set of very similar factors affecting trust in AI when applied to population health rather than healthcare. So at this point, I would like to move on to questions and discussion, and I'd be really interested to hear your thoughts and feedback on what we've presented today. Thank you. Brilliant. I'm delighted to see that many people have shared questions in the Q&A already, but if you do think of other ones, please do add them and please do upvote them. The first question we have, or at least the most upvoted one, asks, what are the difficulties of conducting a public engagement workshop online? Ella and Ava, what are your thoughts?
I've got a few thoughts, so I can jump in first. So I think the reason we did them online, actually, we've been planning to do them in person, but then because of the pandemic, we had to switch them online. And so, while we did manage to reach, I think, a wider pool of people across England, there were a few difficulties that were kind of hard occasionally to manage. I think the first one that comes to mind is with engagement with people online, because one of our principles was we wanted to make sure everyone felt really comfortable in the sessions. So we didn't want to make everyone turn their cameras on, and I think that did make some people feel very comfortable because they could kind of participate but not have to show themselves. But it made it quite difficult to know if people were understanding what was being said, if they'd just left their laptop on and had gone off to make a cup of tea. So that was kind of difficult to gauge, and I think could maybe impact the feeling of kind of all being in a group together. And also when you're online and if someone writes a comment or has a question, there's sometimes that radio silence where I think is kind of us from UCL didn't want to jump in immediately. So because we wanted to not take charge. So you always want to have that balance of feeling like everyone can contribute, but then you get that awkward Zoom silence. And so those are the two things that come to mind. Ava, you have any more?
Well, I think the interesting thing is that it's inherently a very different type of engagement, right? So we were fully prepared to do it in person, which I think also, you can transport your charisma, and the interactions between people are very different in person than they are online. So I think it's a completely different type of engagement. And I think we all kind of had to navigate that a little bit. But it's also managing the number of participants and the type of participants, right? Because we wanted to be as inclusive as possible. But obviously by moving it online, we did offer, vouchers for internet and that sort of thing to make it as accessible as we possibly could. But obviously there's still certain barriers. And we noticed that sometimes, people had issues unmuting themselves or participating in activities, and we found workarounds, but it just means that you had to be that extra bit patient and just in the moments, little problem solving things. Okay, if someone can't access the Jamboard or this virtual whiteboard we're working with, how are we gonna get their answers, because we want to make sure their voice is heard, and then you start copy pasting their answers from a chat onto that to make sure they're present. And I guess the other part is literally just the sheer number, because we had quite a big group, and making sure that everybody gets to participate in a way that, they felt like they actually were part of the project was a little tricky too.
Yeah, and I think just to add, we rapidly learned that some kind of online technologies weren't really viable for people who were joining via their phones. So obviously one of the things is that you don't want to exclude people from certain socioeconomic groups from your public engagement work. But then we discovered some things really weren't possible to access from a smartphone, that sort of what they were looking at was just too small. So we very rapidly sort of reduced the number of pieces of tech we were using to ones that we found that were kind of compatible with people joining on their phones. And that then was one of the things that slightly informed us having to change the workshops from week to week. If we found a technology actually was really badly behaved for people who are accessing via a smartphone, then we sort of had to rethink what we were going to do in the next session.
Just to add actually on Ava's point about kind of the contributions, because it was a group of 24 of us, and we did so people could contribute verbally, but we'd have the Jamboards. But it was, I think, for people who are more confident contributing verbally, there was a slight risk that they would be a bit richer and be able to sway the way the toolkit was developing compared to someone who was just typing in the chat box. So I think that was an interesting thing to manage, with who was comfortable contributing verbally and who wasn't so much.
I'm having minor tech problems in that I can't see the Q&A. So maybe Ella, could you ask the next one?
Yes. So the next one is, how did we recruit our participants? I'm happy to jump in first. So we recruited them through a number of sources. We had a connection with Everyone Health, but I can't remember why we were connected with Everyone Health, Alison.
They'd done some work in smoking cessation before, and we knew that they worked particularly with diverse communities across the country. So it was a chance to work with an organisation that was commissioned by public health services within local authorities to provide smoking cessation services, and that we knew that they could help us find people from across the country rather than just one area, which we thought was important. So
it was very important. I'm glad to know that. So we contacted Everyone Health and created Facebook posts that I think they shared among their many Facebook communities. So that was one source of participants. I have had a brain blank. I even wrote the slide that I just presented about the next source.
We worked in collaboration with the Co-Production Collective here at UCL, and they were helpful enough to share our project with the people who they're familiar with, who are interested in taking part in health-related public engagement projects. So that was another source. Another place we actually got people from was actually people employed by Everyone Health to deliver behaviour change interventions, because actually those are people whose jobs might be affected by the implementation of this AI system, that actually, if the AI system's prediction was there's no need to do face-to-face group smoking cessation interventions, we can do it all online or via an app, then actually their job would disappear. So actually we wanted some people who are going to be affected by the public health decision making in that way included in our groups as well.
And I think we got quite a big group, because I think we were anticipating there to be a bit of attrition. So we thought, okay, and we had loads of responses. So we were like, this is great. So many people want to be part of this, and we didn't really want to say no. So the group was bigger than intended and actually didn't drop off. So yeah, that kind of accounted for the large group size. Alison, can you still see the question and answer box?
No, I still can't see it. So you could carry on. Sorry,
okay,
everyone.
I'll do the next one. Okay, so Rachel Breen says, love the idea of feedback forms to help show you have listened. What's an example of feedback that couldn't be addressed? Oh, sorry, and I've skipped Helen's question. Okay, we'll do Rachel's first, and I'll go to Helen's. Ava or Alison,
I mean, I can jump in. The two that come to mind immediately. So the first one is breakout groups. You know, we had a lot of people we did consider it, but we had a graphical recorder who recorded the discussions in like really, you know, a nice visual way. So that was a little bit tricky. But I think the key one that I completely, as someone who also teaches, understands was the request to have the slides available before the sessions. Now, we had a session every Wednesday evening from 7 to 9 p.m. As you can imagine, the turnaround on the content, also because we adapted to what we actually discussed in the previous workshop, was very quick. So that was one of the things that, you know, ideally, yes, we would have done it, but because we had such, you know, a short time to adjust and generate the workshop materials for the next week, that unfortunately that just wasn't possible. But we made sure, you know, that people are able to look at things afterwards in their own time, just because we're aware we couldn't do it beforehand. And I think those are the two key things that come to mind. I don't know if the others have more thoughts on that.
No, I've got ideas about feedback we did listen to, because yeah, those are the two that came to mind about things that were tricky. But I think that I've also just got a reflection on that as a kind of a tool to show that we were really listening. I think that as a takeaway, if ever I did a public engagement project again, would be something I'd try and implement, because it was nice just to be really transparent with the fact that we're getting feedback. So often you can just fill in a form and you're thinking, has anyone even listened? So it was a great way to really show that we were listening, and helped us shape the content, because I think it fed into kind of with public engagement. I think my idea was that from the start was like everyone just contributes equally, and that's what it means to be, you know, have a public engagement project. But that's not really, I mean, wasn't really what happened there. We found we had to have a bit of structure. And so this was the one way that I felt we really allowed participants to shape the content of the sessions and the structure, and yeah, really respond more like a live way.
Yeah, I think some of our early feedback was that people weren't necessarily understanding everything that had been discussed, and therefore we realised actually that you have to give people enough information that they can then participate meaningfully in the public engagement. So actually people need to have enough information to be able to know what they're basing their views on, to feel that they sort of understand the issue being discussed. And so I think one of the changes we did, Miyake, as Ella says, is just a little bit more information provision, just to make sure that people kind of starting from the same set of assumptions and had the same understanding about when we talked about AI, we talked about a computer system, or we talked about public health, what exactly we meant by those phrases. Okay, I'm going to move on to the next question in the interest of time, which is, did you find it easy to come to an agreement on the purpose and content of the toolkit? That's a very good question. It seemed quite easy, but I think it was sort of led by a couple of participants, the suggestion, then sort of others then sort of agreed with it. I don't know if we had actually an entire kind of session devoted to saying what should be content.
I think this is interesting. I think we could separate it into the purpose and the content. I think that as a project, we'd almost decided that the purpose of this toolkit was to kind of help facilitate appropriate trust in AI. And so again, going back to what I thought public engagement was, I realized that you can, even if you decided something, you can still achieve a goal with public engagement. It's not undermined if a purpose is pre-established. But then the content was, I found like in the last 2 sessions, because we used lots of polls and people were able to comment, it seemed to be kind of easy to see what people were liking, not liking. Although one thing that I think people found difficult to comment on was the text in the resources. I think that some people said that they found it quite overwhelming if we showed them a resource in the web and in the workshop to give feedback on straight away, because some people took longer to process the information than others. So we then adapted the workshops to more focus on kind of the graphics and the colours rather than the content.
Yeah, and then we emailed out the content afterwards so that people could look at it in their own time. So we had people with ADHD, we had people with dyslexia, we had people with autistic spectrum conditions who all fed back that actually this was a little bit too much and a little bit too overwhelming, too fast. So instead we kind of slowed it down, went, here you go, here's the text, have a look at it in your own time, let us know your thoughts, in a way that sort of didn't put people on the spot or make them feel overwhelmed. So I think that was a key learning. Actually, some content is more easily discussed in sessions, and some might actually benefit from giving participants the time to reflect at their own pace on it and suggest changes. Okay.
I think that's also an interesting one in terms of the evaluation paper we have come out, right? Because we, as let's say the researcher group, like we had to think about beforehand, you know, and I think what was quite interesting to think about was this comparison of what we would have put in a toolkit and what actually ended up in the toolkit. You know, and then it's not just the purpose and the content, but it's also the shape it's taken, you know, the layout or the design of different things, but also actually what's in there. There are things that we didn't think about when we thought about what would our toolkit would look like. So it's really nice to see that difference in content, shape, and form based on engaging, you know, with a broader group of people and doing that public engagement project. So it's good that, you know, I think the agreement came really through that process of engaging and talking about things.
Okay, in the interest of time, I'm going to move on to the next question, which asks, were the public ever made aware of what alternatives might be, e.g. non-AI means of trying to have the same outcome? So I think the answer to this is yes. So what people were asking the toolkit to be used for was to sort of say to public health decision makers how much citizens actually wanted them to use this system in making a decision. Did they think it was trustworthy? Did they have concerns about it? You know, did it contradict their values in some way, like they very much valued fairness and they thought the system wasn't sufficiently fair? So yeah, it was very much a sort of the process they came up with was almost kind of, we want to tell decision makers how much attention they should be paying to the outputs of this AI system. It wasn't a, we are going to use an AI system, you tell us what I think. It was much more sort of, should this AI system be factored in? And if so, what opinions do you want to share with public health decision makers about it? Okay, next question. Is trust in the developers of AI tools seen as separate to trust in the AI tool itself? Ava, that sounds like one for you.
It's a very good question. I would say that based on the system review that we briefly presented and the public engagement work, that it's not completely separate, just because obviously the tool doesn't exist without the developers. Now, you might say that the relationship changes a little bit based on, you know, how prominent the tool is there, but it might also depend on what measure you actually use to investigate trust, right? So when I talked about benevolence, for example, I don't know if benevolence is something that really fits in the AI context, but a lot of people use it as a measure to see whether people trust in AI, but then kind of find that it's more actually a proxy of the company because a technology itself doesn't have free will. And if we, you know, look a little bit broader, distrust in big tech such as Facebook, Google, and so on is part of the reason why people distrust technologies such as AI. And if we think about it more from a regulatory perspective, if we look at the artificial intelligence high expert group from the European Union, they specifically state as well, trusting AI cannot be independent from trusting the company. So I think the precise nature of the relationship between company and technology might vary, but personally, based on I've experienced, what we've encountered as well, people talking so much about the background and who's invested in this and why. I don't think it's completely separate entities.
Brilliant, thanks, Ella. Next question, were there any common misconceptions or preconceptions that you encountered? I don't think we did particularly. I think one of the things is we didn't advertise this project about being about AI. We advertised it as being about a novel computer system because we didn't want people to come in bringing baggage or preconceptions about AI. But yeah, I think people were mostly slightly baffled as to what exactly AI did and what it was. And in fact, we ended up having to explain machine learning by talking about a system that learned preferences for pizza and how you might sort of feed someone a margarita pizza, so cheese and tomato, and they liked it. Then the system tries putting ham on the pizza and they like that. And then the system puts ham and pineapple on the pizza. And at that point, the person says, I don't like this anymore. And the system is starting to learn about pizza preferences. So we had to sort of strip machine learning and things like that right back. So that was an example of a very simple prediction system, making predictions about what pizzas you might like to really kind of get people to understand it. So yeah, I think because we didn't recruit people specifically using AI as a buzzword, we didn't see misconceptions. We just saw a lot of people weren't quite sure what it was. I don't know, Ava, you got any thoughts to add on that?
I actually think that this point, I think actually touches on one of the misconceptions. Because I think some people came in as soon as they heard AI, they were a little bit like, oh, but I'm not Bill Gates. I don't know a lot about technology. And I think there's immediately quite often, because AI is such a buzzword, a bit of a hesitancy to engage with it. And I think as soon as we broke down to, okay, let's talk about how someone learns about what pizza they like and predicting whether they're going to like a pizza or not. And then when we look at the comments and the feedback, people were like, oh, actually, I actually understand now what's happening. And I think there is a bit of a misconception around AI. And I mean, in the project, it might not have been as prominent, but I think there was this a little bit there that if we, put it to a larger scale, we might see a little bit more of that.
Thanks. Next question. Are there any evaluation measures or metrics for measuring the trust of an AI assistant tool? So is this something like an Alexa, I guess, or something like that? Ava, any thoughts on this one?
I'm not 100% sure I'm understanding the question.
I'm wondering if they just mean, is there some sort of questionnaire for measuring trust in AI?
So there's loads, and that's part of the problem. So it's going to depend on what exactly your tool is and what exactly kind of you want to measure, right? Because trust can be, if we look at it conceptually, trust can be measured as an attitude and as a behavior. So depending on that already, you'll have to chuck out a fair few types of measures that you can use. And then it's going to depend on what kind of system you have and what the key, things are that you want to measure. Of course, you can have, come up with your own measure, but I'd say that that's quite problematic because we already have too many measures. If you have a specific tool in mind, feel free to contact me and we can have a look at it together, because I think going through the different things, but is a little, would be a lengthy process, but there are tools. It's going to come down to what exactly you want to measure and what exactly your tool is, essentially.
Thanks, Ava. Next question. Are people with disabilities given a seat at the table on these public panels? Ella?
Yeah, I mean, I'd say yes. I think that we tried to make the kind of the workshops themselves as accessible as possible, and it was very much a key part of the feedback each week was kind of what can we do to make this more accessible. But I think we didn't gather data on the participants themselves as much. So the kind of, I wouldn't have a kind of clear answer on that, except that, we tried, but I mean, I don't know, Alison and Ava.
Yeah, so some participants chose to share that they had particular disabilities with us, and some said that it was good that it was online, that it would have been difficult for them, given the particular health problems they were dealing with, to make it regularly to sort of meetings for 2 hours once every 6 weeks, every single week. I think we should acknowledge that we didn't have live captioning at a high quality. So for people with hearing impairments, we may not have been able to include them. As I mentioned earlier, we did become aware that some of our practices were perhaps unhelpful to people with neurodiverse conditions such as ADHD. So I think we did our best, but we have to admit that it was an imperfect process. And in an ideal world, we'd have had money for an interpreter. We went to a really great session actually run by a group that was running sort of online things for people with disabilities during the pandemic, called the Staying In, where they actually shared their tips on how to make your online activity as accessible as possible for people with disabilities. So we action that advice, but I'm very aware that that does not mean we perfectly included all people with disabilities. Okay, next question. Interesting one. Any thoughts of perverse impacts? Models that search for patterns, so most current AI systems, can be really compelling but causally wrong. For example, thinking of issues around cancer screening. Ava.
Sorry, I'm just looking at the question so I can understand.
So I guess this is a question of sort of, AI may actually look great, but actually be coming to the wrong conclusions for the wrong reasons.
Yeah, I mean, that's part of the issue, right? Because, and then I think that's why we said we don't want, people to just blindly trust, but we also don't want categorically distrust, because the reality is, just like with humans, it's somewhere in between, and it's going to depend on the tool. And of course, it needs to be something that functions. And I think that actually ties into one of our motivations for the public engagement, but also more broader, what we need is, we can have all the transparency that we want, but if the transparency isn't meaningful, or if people don't have the skills to understand what we're making transparent, then these efforts are kind of going to waste, right? So we kind of need to combine that really with not AI, but like generally digital and data literacy to kind of get to that point. And of course, there are things that don't work well. Now, the question is, how can we get people to judge, the trustworthiness of that tool in a way that is in line with the capabilities, right? And education is going to be one of those channels, and transparency is going to be another channel. But as Ella knows, I have a lot of thoughts on transparency. I'm not going to digress into that, but they are going to be there. And I think it's our job to help people to get to the point where they're in a better position to evaluate whether something has a negative impact, and then be able to be in a position to decide not to trust it.
And I think the other thing to add to that is that, there's a pressure that actually needs to be exerted on the developers of these systems to say, you need to provide this information so that people can arrive at these decisions. So these are the things the public wants to know. It'd be great if actually the information standards to go with an AI system kind of reflected the things that the public told us they were concerned about. I think we've got time for one more question, which asks, to what extent has the toolkit been tested and evaluated? And I think the simple answer to this is it hasn't been. It's been created. Our brief was to create a toolkit. We would love to evaluate it. We didn't have the money for it. Ava, I know you're doing some work which builds on part of it.
Yeah, so I'm currently, the last study of my PhD is taking parts of the toolkit and kind of testing whether it generalizes to a bigger group and what kind of influence it has on people's trust in a triaging problem. So ask me again in a few months' time, and I can say a little bit more about that. But just being said that, I'm using a few things. I think there's a lot of room for the actual toolkit to be tested in an experimental setting, to see whether it actually can help people to get a better understanding and adjust their trust. But unfortunately, we haven't had the time or resources to do that yet.
We have that just on evaluation, because I spotted there was a question that we haven't answered that was put as answered, was about evaluating public engagement, like how do we know we actually achieved it? And that's something that we're actually trying to write up as a paper, because I don't think it's done so formally as much, because it's quite hard, because there's no standardized agreement of what is public engagement. But kind of quickly, we kind of came up with a definition of public engagement and used that to try and evaluate the extent to which we achieved it. And we kind of used the feedback forms each week, and also we kept diaries, which I was reading before this webinar to remind me of kind of how we felt things went. Kind of did we use temperature checks? How much did we think we incorporated feedback and stuff? So that's all being written up in a paper that will hopefully be published soon.
Yeah, so we sort of had a definition of what we thought would be good public engagement. We then matched the metrics that we collected data on each week to that definition, and brought those together with actually some qualitative analysis of people's diaries entries. So we anonymized them and sort of had different team members look at different aspects. So for example, we said that good public engagement had to be accessible, that, if you're not actually making the engagement process accessible to certain people, then that's probably not the very best public engagement. And other dimensions like that, like as Ella said, are we using the feedback we get each week to kind of change and to listen to participants and what they tell us they need. But yes, we are writing up a paper on that, so we look forward to sharing that further. I'm really sorry that we don't have time to get to the rest of the questions that are in the Q&A box. Thank you so much for sharing them. We will put them into our OSF. If you have any further questions you'd like to ask, or you want to make any comments, you can scan the QR code below if that suits you when you're on a phone. In terms of further things, the next webinar is actually a slightly different topic in the HBCP series, which is looking at a tool that helps scientists write papers in a way that will be easier for AI systems to extract information from, while at the same time creating a paper that is still user-friendly for human readers. And then the other thing to highlight is actually we have a launch of the entire kind of machine learning AI system that has been developed as part of the Human Behaviour Change project, which is on the 6th of June with some hands-on sessions. It's going to be really good. So if that's something that you're interested in, I know some people here are sort of interested in the AI side of things, then do sign up. You can scan the QR code, and I think we'll also put all those details into the chat. And yes, if you want to contact us, we're on Twitter. You can find our code on GitHub. We have a website, published papers. This isn't yet published, but they're on Wellcome Open Research. We do have things including unpublished stuff on Open Science Framework, and the recordings of this and previous webinars will be up on YouTube. So if you want to come back and watch anything again, then do. And also if you have questions when you rewatch it and you want to email them through to us, just email the HBCP team and we will be really happy to get to them. But thank you so much for taking the time to join us today. It's been great being able to present this work to you. We're really excited about it. We hope the toolkit does prove useful. And yep, great to have you all here today. And thank you so much for your time.
Thank you.